There is encouraging news tonight regarding another virus. We're about a quarter of the way through the flu season, and the state health department is seeing a remarkably low number of cases. CBS 4's Karen Morfitt was talking with some doctors. Karen, at least for now, they like the trend.
Well, Jim, you may remember heading into flu season back in October, we heard from several doctors saying that we could be looking at sort of a dual pandemic. Well, they're saying now that that would have caused a huge burden on healthcare workers. But what they're seeing right now, they're being cautiously optimistic, and they are saying we are off to a good start. While the COVID battle continues, there's been little need for a fight against the flu.
So far, it's been very mild. We have seen very few flu cases, very few hospitalizations, if any. I don't even know that we've had a hospitalization.
Michelle Barron, the senior medical director of infection prevention at UC Health, says this year has been different.
Not seeing any yet right now is unusual, although I will take it.
According to the latest flu report from the state health department, there have been 12 hospitalizations from the flu this year. The same time last year, that number was more than 300. ER Dr. Marty O'Brien says they've seen similar numbers at Swedish Medical Center.
They're essentially all negative thus far. That's going to change.
Peak flu season is still a few months out, but Barron says continued COVID precautions like masks and social distancing could help to slow the spread.
Also, people are working at home. Like, the holidays are the best and the worst, right? Because if you live in an office, like, there's cookies and there's candy and all the stuff that people get their hands in. And
fewer cases also means a lighter load for healthcare workers.
Maybe getting closer to getting over the COVID-19 pandemic, not having to manage flu on top of it. We will all, again, take it.
We'll take it as well. A couple of other things that they say may be playing a role in the fewer flu cases that we're seeing is no in-person schooling. With students out of school, there's less transmission of those germs, and CDPHE says they saw a nearly 20% increase in flu vaccinations compared to this time of year compared to last year. But considering that flu season lasts clear through April, they are saying there is still time to get your flu shot. For now, we're live. Karen Morfitt covering Colorado First.
Still ahead.
Notice how they fail to mention the actual percentage and the actual information that's vital, right? So now here we're going to go over, if you read the article that it's associated with this, you're going to see the numbers. And I don't know what they all mean. You have lineage and subtype and H1N1 and all that. And if you believe that the flu is being substituted for COVID, or all kinds of theories are abound, let's just say. So please comment below what your theories are on why Colorado sees 97% fewer flu hospitalizations this year. According to data from CDPHE's website, so far the state has only had 12 flu-related hospitalizations this season. This year is what they're trying to say. Colorado flu-related hospitalizations decreased by about 97% compared to this time last year. And that's data from the Colorado Department of Public Health and Environment. This year, the state has only reported 12 flu-related hospitalizations compared to 471 this time last year. So, I mean, it's hard for me to I swear, have conversations with some of y'all. None of my cartel members, but some people I know in real life. Anyway, Amy Dirkrow, an infectious disease doctor with Kaiser Permanente, said several factors could contribute to the decline in hospitalizations this year, with the pandemic and its restrictions being on the list. But she said it would be a challenge to point at one specific reason. This year may be different because people are practicing different preventions like distancing, avoiding crowds, wearing masks, and hopefully hand hygiene. And I could hear a lot of you people saying, yeah. She said it's hard to say at this point if that's related or not because we do not know. We do know that COVID cases are still very much a problem. But people will ignore that, right? So how could it block the flu? All of our prevention, but not COVID. Did we cure the flu? In which world can a medical professional admit to two facts: that we have eliminated the flu by 90+%, and that the measures used to stop corona, mask, washing of hands, and 6 feet apart, social distancing, and even staying at home has helped with stopping the flu, but did nothing for the coronavirus when they know full well coronaviruses cause the common cold? 2020, Clown Planet. I've been talking about this forever. Common cold and the common nocebo effect. Wasn't that effective, so they had to blend in the flu death. So the kicker is that if that is the case, then clearly these measures aren't working for COVID, so we need to stop them and try others. That's true, I guess critical thinking, even if you're applying it to their flawed thinking. I needed a good laugh this morning. Apparently the preventative measures for COVID, mask, hand washing, and social isolation aren't enough for COVID, but they've all but eliminated the flu. It's sad to read the medical professionals come to this conclusion. They will just say that flu is not as contagious as COVID. So they will use this statistics to prove that COVID is not just a flu, bro. The majority of the sheeple, man, that sounded like my brother, I swear. The majority of the sheeple will get the message and not care much more to understand that nobody is measuring for flu cases. So in the end, they will use this statistics to justify more harsh measures. Even if the vaccine failed, they will blame it in the mutations of the virus and that it is the exact reason of why they are talking about mutated forms of virus since the vaccination is started. As Hitler Goebbels said, as long as you repeat telling something to people, even if it's absurd, they will eventually believe it. The man played a role in convincing people to do a Holocaust. He knows something about regarding propaganda. It's almost like COVID is political. So again, let me know in the comments below what you guys think of COVID-19. You already know where I stand. Let's continue reading these Reddit comments. This year may be different because people are practicing different preventions like distancing, avoiding crowds, wearing masks, and hopefully hand hygiene. She said, it's hard to say at this point if that's related or not because we do know that COVID cases are still very much a problem. And this is the response to that. Prior to 2020, the WHO explicitly said that things like masks and distancing do nothing to curb the flu. Now, these very measures are hella effective against the flu, but not COVID. How? Tusco the elephant goes, masks don't work. Japan has shown they don't work during their flu seasons. The other thing they've done is block most international travel. Possibly flu originates in one area and is spread from there. Stopping travel from that area would stop the flu. And then Mr. Squishy is a male nurse apparently, and he goes, I am a nurse in the ER, and we only just recently started testing for the flu. It's goddamn everyone who has COVID, but I haven't seen a single positive flu swab result. It's kind of amazing. And then Namibis says, I don't understand this. Is the flu being covered up / reported as COVID, or isn't it? I agree with that comment there. I don't get what this guy's trying to insinuate there. So anyway, there's 297 more comments. Feel free to go through them for me or with me or however, and send me any tips you guys find to an All-American Cartel LLC at gmail.com. Not going to spell that for you. Comment below. And please be sure to subscribe to the main channel, The Theorizing Theorist, on YouTube. I haven't been posting there for about 3 months. Going to be posting there here in a couple of weeks, like 4 weeks. Really excited for that. So please be sure to make sure you're subscribed to both channels and make sure you're sharing this information so people can get it out to their friends and family, especially for these holidays where they're going to be sitting down with each other, stuck together. Anyways, you know the routine. To God be the glory.